All right, welcome in everyone to another deep dive with us. This time we're going behind the scenes of Medicare and getting into some seriously important stuff. We're talking fraud, waste, and abuse. FWA, it's like detective work, but for healthcare, you know? And honestly, whether you work in Medicare or just want to know how this massive system works, or even if you just love a good mystery, you're going to want to stick around for this one.
It's interesting because you hear these terms, fraud, waste, abuse, but most folks don't really stop and think what it all means, especially in something as big as Medicare that impacts so many people.
Okay, so let's break it down. What's the difference between like accidentally overbilling and, straight up scamming the system? What's the deal with FWA?
Well, the key is intent. With fraud, you're talking about deliberate deception.
Right.
Someone trying to gain something, like a doctor billing for services they never actually provided.
Oh, wow.
But waste, that's more about carelessness, like maybe ordering a bunch of tests a patient doesn't really need, just not being careful with resources.
And abuse, that's different too, right?
Yeah, abuse is more about bending the rules, like a pharmacy, dispensing expired medication to save some money.
So it's not just what you do, but why you do it. That makes sense.
Exactly. And the consequences, well, they depend on how serious the offense is. We're not talking about a little warning here. You can get hit with some hefty fines, be excluded from participating in federal health care programs.
No kidding.
And yeah, sometimes even jail time. It can get serious.
Jail time? Wow. That definitely shows how serious this stuff is. So the government's not messing around. But what about our listener? What about everyday people? What's their role in all of this?
What's fascinating about these training materials we're using is that they really emphasize that everyone, and I mean everyone involved in Medicare, has a responsibility to protect it. And that includes you, the listener.
So we're all part of the solution.
100%. The materials actually call it a duty to report. If you even suspect there might be some fraudulent activity, you're obligated to report it.
Really? Obligated?
Yep. And there are safeguards in place, so you don't have to worry about any retaliation for doing the right thing.
That's good to know. But Medicare seems so big and complicated, so many organizations and people. Where do you even start if you think something's wrong?
Well, it helps to understand the players. You've got your sponsors, and these are like your big insurance companies that manage Medicare Advantage plans, like a United Healthcare or Humana.
Right.
Then you have your direct providers. These are your hospitals, your big clinics, and then smaller entities like individual doctors and pharmacies that contract with them.
So it's all connected, which means, I guess, more people watching for problems, right? More eyes on everything.
Exactly. And that brings us to one of the most important things, honestly, prevention. It's not just about catching the bad guys after the fact. It's about stopping these things before they even happen.
Okay, so how do we do that? What can people do to actually prevent FWA?
Well, it's all about being vigilant. Think of it like learning to see those little red flags that tell you something might be off. Let's say, for example, you work at a pharmacy and you're seeing several prescriptions that are identical, all for the same patient, but coming from different doctors.
Yeah. That seems pretty suspicious, right?
Right. Or imagine you're reviewing claims and you notice a provider who consistently bills way more for a common procedure than other providers. That's another red flag.
Yeah, I see what you mean. It's about, like, trusting your gut when something seems off.
Exactly. You don't need to be an investigator to make a difference. Just paying attention and being aware can be huge. It's about that professional skepticism, Something feels wrong, it probably is.
It's like we're all healthcare detectives or something.
Yeah.
You know what? The training actually has these little knowledge check scenarios. It's like they're testing us, seeing if we know what to do when things get tricky.
Well, let's see how you do, listener. Imagine you're the one submitting diagnoses to CMS so they can pay up, right? And your supervisor, they tell you to just skip verifying stuff and tweak the codes, add some extra codes to get more money for certain patients. What would you do?
Ooh, that's tough. I mean, you don't want to make your boss mad, right? But it just feels, wrong.
It is wrong. In this situation, the right move is to report it. Talk to your compliance department. They're the ones who handle this kind of stuff, and they'll protect you. No retaliation.
Right. You got to speak up. It takes courage, but it's important, Being ethical is everyone's job, no matter who you are.
That's it. That's why these reporting systems exist, to give people a safe way to raise concerns, confidentially.
Okay, let's try another one. Let's say you're in charge of paying claims from providers, and you notice this one diagnostic lab, they're billing way more than others for a simple test. What do you do then?
It's all about those red flags we talked about. In this case, you talk to your supervisor, or maybe go straight to the compliance department. It's not about blaming anyone, just bringing the issue to light so they can look into it.
Yeah, it's like putting the pieces together, looking for the little things that don't add up.
Exactly. It's about awareness, taking action, and speaking up when something seems off. But, we also got to remember something important. Behind every fraudulent claim, there's a real person affected.
That's what I've been thinking about. We've talked about how to prevent FWA, but what about the why? Like, what's the real impact of all this?
That's a question we need to talk about more. We always hear about the money lost, but the human cost is huge.
Imagine finding out you've been a victim of fraud, right? You'd be stressed about the money, sure, but also, would you ever trust the healthcare system again?
Probably not. You'd be scared to even get treatment, questioning everything the doctor says. That kind of fear is devastating.
And it's not just individuals. If FWA is happening everywhere, people lose faith in Medicare altogether. Then the program can't help anyone.
It's this ripple effect. Everything gets worse, the care, the costs, everything. It even stops progress because money that could fund new treatments is being wasted on fraud.
Imagine if all that money went to good stuff, like actual healthcare advancements, cures, new technologies, better quality of life for everyone.
That's the point. Fighting FWA isn't just about rules. It's about protecting healthcare, making sure everyone can get good care they can actually trust.
This has been, wow, really eye-opening and makes you realize how big this whole issue is.
It shows how important it is to make ethical choices at every level. It's not just about Medicare. It's about people.
Right. About protecting people. And, what about the people who actually report these schemes? The whistleblowers, what happens to them?
That's a great point. Whistleblowers are crucial, but it can be really tough for them. They might face retaliation from their jobs, their reputation might get hurt, they might even get sued.
It's like they're putting themselves out there, risking everything to do the right thing.
Exactly. That's why it's so important to have strong legal protections for whistleblowers. They need to feel safe coming forward.
This deep dive has been quite a journey. We went from the technical stuff to the impact on real people.
It shows that every decision in healthcare matters. It affects us all.
It all comes down to doing the right thing, right? Even when it's hard.
And realizing we all have to work together to make that happen.
Before we go, I can't help but wonder, what can we as individuals do to actually help?
That's the perfect question. It leads us right into our final thoughts for today's deep dive.
So we've talked a lot about FWA, what it is, how bad it can be, all that. But what can we actually do as regular people, to help stop it?
It might sound simple, but knowledge really is power here. The more we know about FWA, the better we can spot it, report it, and stop it from happening in the first place.
So education is key.
Absolutely. Learn about the resources that are out there, like those training materials we've been talking about, for example, and make sure you understand your role in the Medicare system, what you can do, your rights.
And what about people who, they think something's wrong, but they're scared to say anything? Any advice for them?
But first of all, you're not alone. Talk to your compliance department.
Mm-hmm.
Or you can use those anonymous reporting systems. And remember, there are laws to protect whistleblowers, so you don't have to be afraid.
It's about having that courage to speak up, even when it's tough.
Right. And knowing that what you do can make a real difference, not just for you, but for other people too.
This whole deep dive has been, honestly, a real eye-opener. It makes you realize that fighting FWA, it's not just the government's job or whatever. We all have to be part of it.
Yeah. It's about creating a culture where everyone does the right thing, where ethics are just part of how we do business in healthcare.
And where people feel like they can speak up, that they'll be heard, and that they'll be protected.
We've seen how bad FWA can be, not just for Medicare's budget, but for real people's lives. It destroys trust, it stops progress, it basically hurts the entire healthcare system.
But I also feel hopeful after all this. If we raise awareness, if we give people the tools to fight back, we can make Medicare something we can all trust again.
That's a goal worth fighting for, and it starts with each of us doing our part.
Well said. Thanks for joining us for this deep dive into Medicare FWA. Remember, knowledge is power. And in this case, that power can protect people, make healthcare better, and build a better future for all of us.
What are your thoughts on Medicare fraud, waste, and abuse? Have you ever had to report an incident related to it? We'd love to hear your experiences. Share them with us in the comments below. Thank you for watching, and see you next time.